Toxicology affects our daily lives as scientists study potentially harmful chemicals in the food we eat, the makeup we apply, and the electronics we use every day.
I see toxicology everywhere. You buy food and think, okay, about the safety of it. And as an Italian, food is very important. But soaps in the bathroom or what materials discard down. It's kind of a destiny for toxicologists to think about it every moment.
Myself, particularly, I do new drug development. We can see ourselves has an impact on patients' life, extend their life expectancy, and also the better quality of life.
As the SOT 2024 annual meeting winds down and you get ready to head home, we're taking a closer look at all the ways toxicology impacts us on a daily basis.
Right now it's time for SOT TV.
And this is SOT TV.
You're watching SOT TV.
Hi, I'm Tanya Papanikolas. We are back today with one last episode of SOT TV before we close out the 2024 annual meeting. Today's episode is all about the many ways that the general public interacts every day with substances at the heart of toxicology studies.
Most products, the exposure is very small, but because we use so many different products throughout our day, these exposures can add up, and at a population level, they can impact our health.
We'll sit down with Marissa Smith to hear about her fascinating study in hazardous chemicals found in cosmetics and how this distinctly impacts people of color.
Toxicology is a critical aspect when it comes to safety evaluation across all industries, be it med devices, cosmetics, textiles, consumer products.
Mansi Krishan from Meta will talk to us about the role toxicology plays in consumer electronics.
There's a difference when technology is your core strength versus when it's just a tool that you use. And TechBio is a new generation of companies who are leveraging tools like machine learning and AI at their core.
And to wrap up our show this year, keynote speaker Chris Gibson will be in the studio talking about the shift from BioTech to TechBio. Plus, we'll round out our tour of some of the world's top toxicological research institutions with visits to Washington State and Canada. But first, we're sitting down with Ugo Lavana-Molina to look back on the latest research into whether aspartame is linked to cancer. Right now, we are sitting down with Ugo Lavana Molina. He is a professor of endocrinology at the Universidad Marista de Mérida. Thanks for being with us.
Thank you.
You study artificial sweeteners, including aspartame, and I know there's been a lot of talk about the potential link with cancer and aspartame. There's been a lot of research going on for many years, and there's some conflicting information that you can find. So tell me a little bit about that.
The confusion is that last summer, two bodies of the WHO released a declaration about aspartame carcinogenicity. And one of the bodies, that is the JECFA, the Joint Committee for Additives, declared that there is no change in the safety general utilization of this food additive in beverages and in food. But at the same time, a committee of research of cancer of the WHO released a declaration that classified aspartame as a possible carcinogen, because some studies with limited confidence shows that there is some linkage with liver cancer. My personal opinion is that these studies, mostly the epidemiological studies, are not well substantiated, and there are subjectivity in the evaluation of the quality of the evidence, and this was taken in account by the JECFA committee to declare that we can still use safely aspartame as we have been using it in the last 4 or 5 decades.
So it sounds like we haven't necessarily reached a definite conclusion on whether aspartame can cause cancer.
Yes.
So I assume that means more research is needed. Where is that research headed next?
The need is to have better instrument to evaluate the evidence, to classify the evidence, and there are some gaps of research that have to be filled, especially in the human area, because it comes from observational evidence. these are epidemiologic studies, and these epidemiologic studies has high risk of bias. So what we need is more direct human studies, what we call randomized control studies, to see if cancer is really a potential hazard in humans. The situation now is that we can consume safely this additive and the food and beverage that contain it.
So you feel like we can safely use that sweetener?
Yes, that is the declaration of the JECFA committee that is in charge of the additives of human consumption in food and beverages.
Anytime it's a food that can potentially cause cancer, people pay attention. So it's interesting to get some clarification.
Yes.
Thank you so much, Ugo. We appreciate your time.
Thank you.
Well, now let's dive deeper into the role of toxicologists in understanding how exposures affect the human body. For that, we go to the University of Washington's Environmental Health and Microbiome Research Center.
The Environmental Health and Microbiome Research Center at the University of Washington aims to advance mechanistic and innovative microbiome science in the field of toxicology and environmental health sciences. We aim to support strong multidisciplinary research among investigators from basic science field as well as clinical and community partnership. And we also foster the mentoring for the next generation scientists in microbiome research and public health. The future for microbiome science is that we really need to support more translational science to identify novel microbial remediation strategies that will bring together scientists from basic science field as well as clinical and epidemiological settings so that we can validate the causation versus association and to find out which specific microbes can contribute to the resolution of human diseases.
You can keep watching SOT TV on screens around the Salt Palace Convention Center, in your room at select hotels, on the SOT 2024 annual meeting website, on the SOT 2024 event app, and on YouTube and X. Right now, we are excited to sit down and talk to Marissa Smith. Thanks for being with us.
Thank you for having me.
Now, you are the Senior Regulatory Toxicologist at the Washington State Department of Ecology, and you study consumer goods and all the potential hazards there are within those. When you think of toxic chemicals, hazardous chemicals, that's really not the first thing that you generally think of, but how I guess, dangerous are they?
That's a great question, and I think a lot of people feel that way. You're surprised to know that there can be toxic chemicals in the consumer products that you use every day. And you know, most products, the exposure is very small, but because we use so many different products throughout our day, these exposures can add up, and at a population level, they can impact our health.
Now tell me specifically about the studies you've done with cosmetics and how they can actually affect people of color even more.
We worked with communities of color in Washington State to identify and test cosmetics for toxic chemicals. We partnered with local health departments and social justice and advocacy groups, and we're really grateful for all the participants that worked with us. And we learned more about the types of products they use, why they purchase what they purchase, where they purchase their products. And then we selected products and tested them for lead, arsenic, cadmium, and formaldehyde.
Oh, wow. Tell us about the results that you found.
The results were pretty good, actually, in a lot of ways. We didn't find cadmium in any products. We found lead in 3 out of 20 products. And this is actually good news. It shows that products that don't have detectable concentrations of lead are possible. And that's really important when you start to think about equity, because we want to extend those benefits to everyone, regardless of the types of products that you purchase. Formaldehyde can be added directly to products, but most of the time that's not why it's there. Most of the time it's there because a different chemical is added, and that chemical breaks down and releases formaldehyde over time. And so when we purchased products to test for formaldehyde, we only purchased products that had a formaldehyde releasing ingredient on the label.
Okay.
So we did find formaldehyde in 26 out of 30 products, but that doesn't mean that most cosmetics have formaldehyde. What it does mean is that when you have a formaldehyde releaser on the ingredients list, we were likely to detect formaldehyde.
So how did it disproportionately affect people of color? Explain that part of it.
Some cosmetic products are marketed more heavily towards communities of color. Things like hair relaxers and straighteners and skin lightening creams. And these products, based on the function and what they do for your hair, may also have toxic chemicals that can impact your body in other ways.
Okay, and then tell us about, now you're getting involved with the regulatory side of helping with this.
After we published our phase 1 study, our state legislature passed the Toxic-Free Cosmetic Act. That passed about a year ago in 2023. And it includes restrictions for a number of chemicals and chemical classes. And it also includes a subsidy program that helps us identify and promote the use of safer alternatives everywhere from the cosmetic manufacturers to salons that need support switching their product lines to compliant and safer products.
So how do you get involved with the promotion of those safer alternatives?
A big barrier to safer alternatives can be transparency. So what we can do as a state agency is share information. So we are working on conducting some hazard assessments, making those results publicly available so that manufacturers can make more informed choices. But we also have a subsidy program that can help reduce the cost to manufacturers and businesses.
It's fascinating research, and I think it affects so many people, so we appreciate you sitting down to explain it to us.
Yeah, thank you for having me.
Thanks, Marissa. Well, we've talked about cosmetics. Now we will learn more about consumer electronics and how toxicologists make them safe for our daily use.
SOT has been a very integral part of my educational and professional journey. It was here at SOT where I met my mentors who have guided me through my career trajectory. Being a part of SOT, being able to attend annual meetings over the past 13 years now, has helped me stay abreast of the scientific advances, present my research, serve in elected SOT committees, leadership roles, and most importantly, to mentor the younger generation, the upcoming generation of toxicologists, and paying it forward. All these experiences and opportunities at SOT have helped me navigate through my career trajectory as I transition from food to medical devices and finally in the tech industry. While regulatory agencies have formal definitions of biocompatibility of medical devices, but to put it in layman's terms, it is the ability to be in contact with the living system without producing any adverse effects. It is not only important to evaluate biocompatibility of medical devices, it is highly relevant for consumer products, consumer electronics as well, and depends on the nature of exposure route. All those considerations come into play while evaluating consumer electronics. Toxicology is a critical aspect when it comes to safety evaluation across all industries, be it med devices, cosmetics, textiles, consumer products. And looking from the perspective of consumer electronics here at SOT, to the best of our knowledge, this is the very first time that there is a scientific session focusing on the role of toxicology in consumer electronics. And some of the key takeaways from this session, the speakers from different sectors, government, industry, consulting, they discussed the different risk assessment toxicology approaches when it comes to biocompatibility and safety evaluation for med devices, cosmetics, wearables, and then how we can leverage these approaches to develop a harmonized standard approach to evaluate consumer electronics, especially the emerging ones. So finding a path forward.
A vital part of growing SOT and advancing great science is making sure that our early career scientists are supported. Up next, we'll learn about some of SOT's opportunities for mentorship and professional development. Then we will hear from you, our conference attendees, about why mentorship matters.
Toxicology is a very complex career and it has a lot of pathways to go. So especially for grad students and postdocs, when they are finishing their career, if you will, in academia, they are a little bit overwhelmed of where to go and how to get there, right? So SOT has a very diverse membership and everybody very willing to help and mentor early career scientists. So it's very important for those newer toxicologists to have this type of guidance. So I think that SOT, through its membership, really help the early career scientists to find their path, to help them, to guide them in their path, and to help them to get there.
SOT has actually taken a multi-pronged approach to be able to support our postdocs, graduate students, new faculty, new industry scientists. And then by taking a multi-pronged approach, we kind of get everybody. So this occurs through formal programming, such as symposia and workshops that we have here at the annual meeting. We also do a lot of it through our component groups. So our component groups include our specialty sections and our regional chapters. And so they've been very proactive in having different mentoring events where it might be speed dating or networking, somewhat formal, sometimes informal, but then also covering some of the soft skills. So this might be having events about interviewing, negotiating your first job offer. And so by having kind of targeted and very relaxed environments for the natural exchange has really been a nice way that SOT has taken kind of a 360-degree approach to providing what is going to work best for different early career scientists.
My advice to early career scientists for making the most usage of SOT's resources is when you see an opportunity, take advantage of it. So whether that's applying for funding for a unique training experience, whether that's going to the mentorship, whether it's getting involved with SOT as an officer, you learn so much from all of those experiences. And I think, as I mentioned before, networking and making connections is the foundation. And so try to talk to people that have similar interest to you, or maybe have taken a path that you're interested in taking, and you get to learn about all the resources from them. They could guide you to a particular resource that's unique for that area of your interest. And so I would just say, be open, be willing, and get involved, and don't be afraid to take a chance.
Is various moments when I felt I'm not as good as, I wished. The encouragement that coming from her voice or her caring towards me is really the first thing popped up in my mind. Is when you have some downtime that you felt you're limited. It's her encouragement that helped me grow and continue to grow.
My mentor is the one who pushed me to submit an abstract for this conference in the first place. I wasn't originally planning on submitting anything because I wasn't entirely sure if the work I had done was super relevant to toxicology, because it's more like computational biology. But she was very encouraging and she thought I had a shot, so she got me to submit it, and now I'm here.
I think the most memorable example of a mentorship I had is when one of my earlier managers said, think what is the underpinning question? What are we really trying to achieve? And then he drove me through a conversation where the only question was, and then what is the underpinning question to this? And then what is the underpinning question to this? And the reason that was very powerful is that I understood that sometimes you discuss things too much into the details and you lose sight of the long-term goal. And he said, begin with the end in mind, which is also a phrase from a famous book. So that's, I think, what I really appreciated in that mentorship relationship I had with him.
My experience as a mentor has been, to just inspire, young minds. Is nothing more exciting when you see one of your mentees, really excited about, something they've accomplished. Like today, one of our papers got accepted in Nature Communications just this morning. And I told my student, congratulations for a job well done. And she was just so excited. I can see that in her email. So, these are special moments.
We want to welcome to the studio right now, Chris Gibson. Thanks for being with us.
Thanks for having me.
So you are the co-founder and CEO of Recursion, which deals a lot with drug discovery.
That's right.
I think your background is interesting. I understand you left medical school to focus on building Recursion. So tell me how that interest got piqued and about that process.
That's right. I was doing an MD PhD here at the University of Utah, just right up the street, and ultimately worked on a project using traditional tools that failed. We were trying to find a new medicine for a rare genetic disease, and we failed. And in that failure, we saw an opportunity to take a totally different approach and use machine learning models to help us see signal we had missed before. And ultimately, that worked well enough that we now have a drug in late stage of phase 2 trials out of that project, and a whole bunch more drugs on the way. And we've been building that idea into a company that we think represents a new generation of TechBio companies.
Oh, wow, interesting. So I know the keynote address you gave on Monday was about the shift from BioTech to TechBio. Explain the difference there and what that process is like.
So the field of biotech and biopharma have been using technology for decades. But there's a difference when technology is your core strength versus when it's just a tool that you use. And TechBio is a new generation of companies who are leveraging tools like machine learning and AI at their core. It's fundamental to what we do. We're essentially digitally native. And so I think there's a shift happening now, both biotech companies becoming TechBio companies and a new generation of companies growing as startups into what I think the rest of the industry will look like a decade from now.
So you have a lot of experience with this. So I want to know from your perspective, how do you think AI and machine learning has really impacted the field of drug discovery?
Well, I think we're at the early innings. It takes 10 or 15 years to discover and develop a medicine. The earliest companies in this space are just about 10 years old. So we're about to start finding out how we're doing. But in terms of getting medicines to the clinic, companies like ours are doing it in about half the time and half the cost. And ultimately, the biggest lever we can pull is increasing the probability of success. If we can go from 90% failure rate in the clinic to even 80% failure rate in the clinic by leveraging these tools, we're going to make an incredible impact in the lives of patients.
What advice would you have for young professionals, even entrepreneurs who are interested in contributing to this field?
I think no matter what you're doing, you have to surround yourself with incredible mentors. If you do that, you're going to see things that you otherwise would have missed, and I think you're going to put yourself in a much, much better position.
And I love how SOT has so many opportunities to get involved with that.
Absolutely. On Monday, after the plenary, I was able to sit down with a bunch of grad students and postdocs and talk about all of the questions that they're facing at this point in their career. It's phenomenal.
Thanks so much for your time, Chris. Now, before we close out our show, let's head to Health Canada for more work on the cutting edge of toxicology. They're using computational modeling, organ-on-a-chip technology, and more to pioneer innovative approaches to chemical risk assessment.
The Chemicals Management Plan is a Government of Canada initiative to protect the safety of Canadians, people living in Canada, and their environment. We've been using alternatives to animal testing even before the global shift to move away from toxicity testing in animals.
Regulatory toxicology is becoming more reliant on data analytics. You have information coming from in silico models, you have information coming from in vitro methods, and along with the traditional in vivo methods.
Our research relies heavily on computational and statistical analysis. The connections that we draw between gene expression changes and health outcomes are actually valid and meaningful and even quantifiable.
Gaining confidence in these predictive approaches is pivotal to moving away from using animals for toxicity testing and prioritizing chemicals for further evaluation.
Health Canada recognizes the utility and potential of organ-on-a-chip and organoid models as a new approach methodology to revolutionize toxicity testing.
It is paramount that we continue to build a common vision to reduce reliance on animal testing and continue to protect the people living in Canada.
with that, we are closing the books on SOT 2024. It's been a great show this year. We hope you enjoyed it as much as we have. If you want to look back on any of this year's content, you can keep watching SOT TV on screens around the Salt Palace Convention Center, in your room at select hotels, on the SOT 2024 annual meeting website, on the SOT 2024 event app, and on YouTube and X. We'll be back next year for SOT 2025. It's in sunny Orlando, Florida. We hope you join us there. Thanks so much for tuning in. I'm Tanya Papanikolas signing off this year. We hope you enjoyed the annual meeting. Have a great day.